I'm going to talk about naloxone. The first question you've all got is probably, what on earth is that? In essence, naloxone is a cure for a heroin overdose. That's the most basic way I can explain what naloxone is, but we'll get onto that more in a moment. I want to talk about naloxone not for any commercial interest or because I'm a medical professional, but because I used to work in drug services here, and I'm currently the chair of the National Needle Exchange Forum for England. So through that experience, I've seen firsthand the impact that this medicine can have on people who use drugs. And I've got many friends today who simply wouldn't be here if it wasn't for naloxone saving their lives. So firstly, I just want to talk about overdose and why this is a problem. The United Nations say that we have 69,000 people around the world who die every year from an overdose from an opiate drug. And opiates include heroin, but also include morphine and methadone and other drugs in that family. So it's a big problem. And you can drill that down to England and Wales, where there's 765 deaths last year. And that's been a huge increase compared to 2012, a 32% increase, just in the deaths related to opiate overdose. And this is, within a relatively small population of people. And we don't really know why that's happened, and it's pretty worrying. You can draw that down further. You can draw that down to Bedfordshire, here in Bedfordshire, where there's been just 26 deaths. We know from experience and we know from research that 1 in 5 people who inject drugs have witnessed somebody overdose. They've actually seen somebody die from this. And 1 in 5 parents and carers have witnessed their loved one overdose, whether they died or not, but they've witnessed that overdose. So this is a common problem. It's actually one of the leading causes of death for people who inject drugs in this country. Now, the numbers are here. They may or may not mean something to you. They may or may not speak to you. And regardless of what you may think of people who use drugs, and we have to face it, most people have an opinion about drug users. It's very rarely a positive opinion, unfortunately. But every single person who dies from an overdose is somebody's son, somebody's daughter, somebody's brother or sister, somebody's mother, somebody's father, somebody's friend, somebody's loved one. These are people who are dying, and what makes it even worse is that these deaths are preventable. These deaths can be avoided. So before we go on, I just want to show you a very short clip of naloxone in action. This is actually a clip from the US, where they were filming some injectors just going about their daily business, just for some research, but they happened to actually film an overdose happening. So the gentleman in the middle has suffered an overdose. He's effectively stopped breathing because there's too much heroin in his system. And his friends have given him naloxone, or Narcan, as they call it in the US, and you can see the effects.
Can you hear me?
Oh, there he is. He's back from the dead.
You just died. We had hit you with Narcan.
You awake, buddy? You all right?
We just hit you with Narcan.
It's a very short clip, but that man would be dead now if they hadn't given him naloxone to reverse that overdose. And that's the power that this drug can have. It literally can bring people back from the dead. So basically, as I've said, it's an emergency response to a heroin overdose. What happens in an overdose is the heroin, because heroin is a depressant drug, so you take it because it kind of depresses some of your functions. When you have too much of it in your system, that depression goes too far, and it basically depresses your breathing to the extent that you effectively stop breathing, and that's what causes a fatal overdose. What naloxone can do is it goes into the brain, it goes to the opiate receptors in the brain, and it blocks them, basically kicking out the heroin, and therefore immediately reversing the effect that heroin is having. So it can immediately reverse that depressed breathing, immediately get someone breathing again, which was that, at the beginning of that video, that deep intake of breath that guy took. That's your sign. When you're dealing with an overdose, that's your sign that the naloxone has kicked in and that guy's going to turn it around. That's your sign. It's been around for ages. This is nothing new. And you may think, why am I talking about it? But I'll explain that a bit later. But because of its effectiveness, because of its safety record, it's recommended by the World Health Organization as one of their essential medicines, as in a medicine that every country should be giving. And the World Health Organization actually last week released their new guidance on naloxone, and they stressed again that this has to be given to people in order to help save lives. So at this point, you're probably thinking, okay, great, but what on earth does this have to do with design? And I'm, aware that that's the theme for today. Now, naloxone, as I say, has been around for a long, long time. It's been around since the 60s, and before a couple of years ago, it just looked like this. It just looked like any other injectable medicine. And it was designed for use by medical staff, by ambulance crews who happen to get to an overdose, by A&E staff, by anaesthetists, because if you've got an anaesthetist giving you morphine, they have some naloxone in their back pocket ready in case something goes wrong. So it was a medical intervention. But what we've started talking about in the last few years is something called take-home naloxone. We've redesigned the product to make it relevant to non-medical interveners. So it can now be given to drug users. It can now be given to their parents, to their friends, to their colleagues, because they're the people who are going to be there when an overdose happens. And it's much the same. I don't know if anyone here has ever come across EpiPens before for anaphylactic shock. It's exactly the same principle as this. It's an injectable medicine for an emergency, but you give it to someone so that they can give it to their friend, to their mother, to their father, they can keep it in their cupboard, in their kitchen, they can keep one at work, so that when an anaphylactic shock happens, you have the tools to hand to be able to help save your life. And so this pack comes with information that is targeted not at ambulance crews, not at medical professionals, but at drug users and at their families. And that's how we've managed to redesign this intervention in order to get it into the hands of the people who can use it best. Now, at the same time, we've seen a real kind of grassroots push from drug user communities and from advocates like myself to try and push for naloxone, to try and raise awareness about this drug, to let drug users know that there is this drug out there, but you really should have you should have some of it in your cupboard because this could save your life. And this includes posters, it includes t-shirts like this one, we've done badges, stickers, Facebook campaigns, the whole gambit of different ways to raise awareness about this medicine and to really try and to reach out to people and let them know that this is something that could save their lives. And most of this design has been done by drug users themselves. And the aim has been to get it into the hands of drug users so that we can give it to the people who are likely to be there when an overdose happens, so they can save their friends, they can save their colleagues. At the moment, in Scotland and Wales, we have national programs for those countries, which means that there's a national system in place so that people who use drugs are given naloxone, almost routinely given this drug, so that they can use it if they have to. Hopefully, they never have to use it. That would be perfect. Hopefully, it reaches its sell-by date and they just have to bring it back. But you're giving it to them in case of an emergency. But in England, unfortunately, at the moment, we don't have a national program. We're actually lagging quite far behind. And we have what we refer to as a postcode lottery. So, for example, here in Bedford, drug users are not given naloxone here in the town of Bedford. And yet, in neighbouring towns, drug users are given this drug. So there's this real kind of strange situation where it's a complete lottery as to where you live. And it's worth bearing in mind, remember earlier I said about a 32% increase in opiate deaths in England and Wales. Scotland in the same year has reported a 7% decline, and Wales actually doesn't account for any of that increase because they actually levelled in terms of their trends. So you can see the impact that this is having, certainly north of the border. And at the same time, there's also more design work we have to do with naloxone, because the product we have now, even though it's designed for non-medical use, for non-medical interveners, it's still physically a needle in a syringe. And if, like myself, you've never injected a drug, and I'm by no means a medical professional, that's a nerve-wracking thing to have to do, especially if someone's life is banking on it. To have to attach a needle to a syringe, and there's still a lot of stigma attached to that bit of kit. So we're working on different designs to get intranasal use so that it can be sprayed up the nose instead of injected into the body. Or even to have some products like the EpiPen. I mean, for those of you who have seen an EpiPen, it looks like a pen. It doesn't look like a needle and syringe. And that's a really important design feature because it doesn't carry that same fear factor that people have about needles and syringes. So the conclusion is simple. Naloxone can save people's lives. And that's why I'm here talking about it today. That's why there's lots of people talking about it across the country, because we're trying to increase the access to this drug. And you have to forgive me, I've got 2 young children, so every life reference I have now is a child's book or a child's film, so I apologise for that. But there is a genuine message here. If any other population of people had a 32% increase in death rates in 1 year, there'd be inquiries, there'd be media coverage, there'd be outcry, and there'd be people saying, well, what are you going to do about it? But because this is drug users, no one cared. It didn't even make it into the newspapers when that data came out. No one cares. And this is why I'm here talking about it today, because we need people to care. We need people to see that these are lives that are worth saving. So there's more information here if anyone is interested. Thank you so much for your time and thank you for listening. Cheers.